Hi, my name is Victoria. I'm a student pharmacist here today, and I'll be presenting over our patient. She is here today with increased asthma symptoms. A little bit about her and her history. She's 27 years old, African American, female. She does have a history of persistent asthma and generalized motor seizures, and that is controlled on topiramate. We'll talk about that later. She is complaining of increased asthma symptoms, but does not appear to be in acute distress. She states that she has daytime symptoms about 3 times a week, uses a rescue inhaler 3 to 4 times a week, but does not usually use it multiple times in a day. She is awakened by her asthma symptoms about once a week. They are not tied to an exertion. She states that she has good compliance to her asthma medications and she does demonstrate proper inhaler technique. The patient's wondering if she needs a change in her asthma medication. So her past medical history, she has persistent asthma for about a year. She is on maintenance and a rescue inhaler, and she does have the generalized motor seizure, and she's stable right now. She has no pertinent family history. She does deny recent alcohol use. She is a former smoker. She quit about 3 years ago, and she does have insurance. So her medications and allergies, she does have an allergy to gabapentin. Her reaction was edema. She's on topiramate 100 milligrams by mouth, BID. She's on an oral contraceptive, Trisprintec, 1 tablet by mouth, once daily. She's on a Flovent inhaler, 44 micrograms, 2 puffs by mouth, BID. She's on Ventolin or albuterol inhaler, 2 puffs PO every 4 hours as needed for shortness of air. Her immunization history, she's up to date. She had flu in January and she is fully vaccinated against COVID-19 and boosted. Her review of symptoms, she was marked for lethargy but no acute distress. Her respiratory system showed an increase in asthma symptoms. Her psych system was intermittent insomnia. Her back, thorax, and lungs displayed mild wheezing. All other systems are unremarkable or within normal limits. For this patient's vitals, her blood pressure was 110/72. Her heart rate is 90 beats per minute. Her temperature is 36.8 degrees Celsius today. She has respirations of 18 breaths per minute. She's 69 inches tall. She weighs 72 kilograms. Her BMI is 23.3. As of now, she is healthy. Labs for this patient, her protein was low at 4.2. The range should be about 6 to 8.3. Everything else was in normal limits. Her serum creatinine was 0.8, so her creatinine clearance was estimated at 120 milliliters per minute. So for today's problem, the patient's having increased asthma symptoms. The evidence or rationale of this, she's having uncontrolled asthma symptoms despite adherence and proper technique for her inhaler use. According to the GINA 2022 report, the patient is currently on step 2 of therapy with a reliever inhaler and a low-dose inhaled corticosteroid of the Flovent, and it's low dose because it's less than 250 micrograms. Because she is experiencing daytime symptoms, using the rescue inhaler 3 to 4 times weekly and being awakened at night, it's recommended that she escalates to step 3 of therapy with a low-dose ICS LABA, as well as continuing the reliever inhaler. So due to this change in step therapy, the patient would need to discontinue the current ICS inhaler at home. That's the fluticasone, the Flovent inhaler. And she, according to her insurance and following the recommendations, she is eligible for Symbicort, Advair, and Dulera inhalers. For the goal for today, this patient's goal is to reduce her symptoms and control her asthma and prevent exacerbations. So for her drug regimen, we're choosing Symbicort or budesonide, generic budesonide. Her dose would be 80 per 4.5 by mouth, 2 puffs by mouth BID. Let's see. So for safety and toxicity, we're going to be monitoring, or the patient is going to want to be educated and monitor on oral candidiasis. That is thrush in the mouth, a fungal infection from not washing out the mouth from the use of the oral corticosteroid. Upper respiratory infections, tachycardia, blood glucose because it is an oral corticosteroid, and serum potassium. For efficacy and improvement monitoring, she's going to want to follow up for pulmonary function tests. And that's all I have today. Thank you. And what questions do you have for me?